Hello, my name is V. Bowie, and I'm a fourth-year pharmacy student at UNC Eshelman School of Pharmacy. I am presenting my research with Duke University Hospital on the evaluation of sublingual selenium in patients requiring home parental nutrition. Selenium is a trace element essential for a variety of biochemical functions listed here. If you take a look at the figure on the right, selenium is being used for selenocysteine synthesis, which helps glutathione peroxidase to defend the body against oxidative stress. Selenium deficiency in its extreme form can present as myocardial injury and/or cardiomyopathy. One of the biggest risk factors for developing selenium deficiency is use of parental nutrition. A study by Potash and colleagues evaluated parental trace element dosing, concentrations, and frequency of monitoring in patients who are receiving long-term home parental nutrition. This retrospective observational study included a total of 26 patients. With the mean daily selenium dose of just over 69 micrograms per day, over a third of these patients had a serum selenium below the reference range, regardless if they had short bowel syndrome. This suggests that patients on home parental nutrition may require higher selenium doses to maintain serum concentrations within the reference range. Like the study by Potash and colleagues demonstrated, patients on parental nutrition would require higher doses of selenium than the dietary reference intake and FDA recommendations, which is reflected by ASPEN recommendations of 60 to 100 micrograms per day. Selenium can be supplemented through these formulations listed here. In August of 2019, the drug manufacturer discontinued MTE5C, MTE5, and IV selenium products. It replaced IV selenium with a new product, IV selenium acid, with a marketed 1,300% price increase. Subsequently, Duke Home Parental Nutrition sought after a more cost-effective alternative by converting patients on IV selenium to sublingual selenium. The objectives of our research were to evaluate the efficacy of sublingual selenium alone or in combination with IV selenium and the MTE product in home parental nutrition patients, and to determine associated cost savings with maintaining selenium requirements with sublingual selenium through a retrospective chart review. We included adults followed by the Duke Home Parental Nutrition team, who were then converted to using sublingual selenium and had one serum selenium level drawn after the conversion. The primary outcome was the percent of patients with a serum selenium within reference range. Cost savings were measured as the change in the cost of the newly available IV product before and after the intervention. Our study population included a total of 15 patients. The average patient was a 55-year-old white female that was overweight. I also wanted to point out that the majority of patients had a parental nutrition indication of short bowel syndrome. Additionally, these patients also had high volume, protein, and caloric requirements. Our research showed that over 70% of patients were able to maintain serum selenium within the reference range, regardless if they had short bowel syndrome or not. Taking a closer look at the selenium provisions, patients in the study required a total IV dose of about 100 micrograms per day at baseline. During the intervention period, when patients on IV selenium were converted to sublingual selenium, patients were receiving their selenium requirements mostly through sublingual selenium. Similarly, after the conversion, patients were receiving just over half of their selenium requirements through the sublingual formulation. This graph demonstrates the associated cost of maintaining selenium requirements using the cost of this new product and sublingual formulation. After the conversion, this resulted in projected cost savings of over $178,000 for the health system. The main takeaways from our research include sublingual selenium may present a viable option for patients with malabsorptive syndromes. IV to sublingual conversion resulted in over $178,000 in cost savings for the health system. And finally, this is the first study to our knowledge to evaluate the use of alternative routes of selenium administration in home parental nutrition. I would like to especially thank my research mentor Sarah Bliss, as well as the rest of the Duke Home Parental Nutrition and Duke Home Infusion teams. And this concludes the end of my presentation. Thank you for your time and consideration.